Good evening, everybody. I put together a few slides to recap the material that we've covered over the last 8 weeks of class, or actually 6 weeks of class. The obturator sign. This is a method to determine whether there is a suspicion for appendicitis. So know how to do that. Constipation. Constipation really is not identified unless they have less than 3 stools a week. Actually, those standards are going down even more. The stools will be very small, or very large rather, straining with bowel movements, small hard rocks when they do have a bowel movement. There are actually constipation clinics at some hospitals that will help children, and Miralax is one of the products that they most commonly use because it's made differently. Hydrocele. Hydrocele is an opening in the testicle that allows fluid to build up. This is diagnosed by using a pen light. If you put a pen light up to the testicle, you'll see a red transparency in that testicle. So that's how that one is identified. Pyloric stenosis. There are two valves in the stomach, the cardiac sphincter up here and the pyloric valve down here, where food empties into the small intestine. With pyloric stenosis, there is a stricture here that doesn't allow food to move into the small intestine. It causes projectile vomiting. It's typically identified by actually 2 weeks of life. It can be up to 6 months as well. This is a surgical intervention to correct. Oh. Osgood Schlatter. This is occurs in growing children, and they develop this protrusion below the patella, and it is a tibial protrusion. It causes leg pain, knee aches, and it goes away on its own. There's no treatment. They outgrow it, but it can interfere with participation of sports. Newborn hip dysplasia. Breech presentation is more likely to have this, but it can be of a congenital form as well. 2 tests we do on all babies when they're born are the Barlow and Ortonelli tests. That's where we take their legs and move them in a forward motion and then out and listen and feel for a click. If it's positive, then they'll have an ultrasound to confirm the diagnosis. Children who have this will be in a Pavlik harness, and sometimes they're in that harness for several months. They used to routinely cast, but they don't do that any longer. Torticollis. Torticollis is a shortened muscles on, it can be either side. This is a right-sided torticollis. You can see how their right ear tilts to the right shoulder and a tight muscle. The nose faces to the left, so that's a torticollis. Cranial nerves. I want you to focus on cranial nerve 10, 9, 2, and 5. Deep tendon reflexes. Be familiar with what the normal deep tendon reflex would be in the specific areas. Cerebral palsy is the most common neurologic condition that occurs in the newborn, and this is something you need to focus on a little bit when you're studying. Macrocephaly refers to a large head. Montgomery glands are little glands directly behind the nipple, and during puberty, they begin to swell. They turn into what's called a little breast bud, and it feels like a little marble back there, but that is, you'll see this in breast development. Hypospadias is an opening on the underside of the penis that can be in varying degrees. The sequence of puberty. So have a general understanding of how puberty occurs in the female. Typically, the onset of menstruation is the culmination of puberty. Tanner stages in the male, know particularly what different characteristics you'll see at the different stages. A pediatric headache. Now, pediatric headaches are a little different than adult onset headaches. Kids usually get migraines and tension headaches. And with headaches, it's always concerning in children. And especially if they occur when they wake up with a headache, they wake up in the middle of the night with a headache, they get a headache at night. Those are all signs that there may be some malignancy. But vomiting and nausea and vomiting with a headache in children is not always a cause of concern. But as I said before, any headache in children needs to be evaluated. Cryptochidism is undescended testes in the child. So you can see that this one is in place and this one is not. As the skeletal system matures, you can see that changes such as elongation of the bones and fusion, ossification, capping, and fusion occur. How much should babies eat? Well, typically breastfed babies want to eat every 2 to 3 hours. Bottle-fed babies 3 to 4, but have a general understanding. That's a newborn stage. Mononucleosis, the signs and symptoms are typically sore throat, fatigue, pussy tonsils. Oftentimes it's only one. Swollen gland, typically on one side. The big thing with this is you need to consider that there is no cure, there is no treatment except for rest. Sometimes I'll give these kids steroids if their throat is too swollen, and they need to avoid contact sports for at least 12 weeks. That is due to concerns of trauma to the spleen, because they can get spleen enlargement. Urinary tract infection in children is not terribly uncommon because of different structural wiping. Bactrim is typically the first-line drug of choice in kids that have a pyelonephritis. And we are going to do a urine culture on these kids. We're going to dipstick them in the office, but we're going to send out the urine for a culture. ECG and echo clearance for sports. Any person who answers a yes in the cardiovascular screening section of the sports physical form needs to have clearance through a pediatric cardiologist, and that means an ECG and an echo. That's an extra slide, ignore that. Lower lobe pneumonia can often present in kids with pain in the upper right quadrant. Turner syndrome is a chromosomal abnormality where they are missing an X chromosome on the 23rd pair, and you can see some of the characteristics there. Gynecomastia, this happens in about 60% of all adolescent males, and it is due to increased sensitivity to estrogen and lagging free testosterone. It typically will go away on its own, but in some severe cases they actually will have that breast tissue removed. Galactosemia is a metabolic disorder where the children have they are not able to metabolize galactose, and that is a test that's done on all newborns. Cellulitis, you can see this little kid has this swelling in the rectal area. This is perianal strep, typically treated with antibiotics. So this is not a diaper rash, this is cellulitis. And group A strep is a common culprit for cellulitis. Tetanus is an infection that occurs through a puncture wound most commonly, and the tetanus toxin actually hangs out in the soil. So I know we're worried about rusty nails and all that stuff, but we really need to be worried about puncture wounds when they occur on the barefoot kid outside. Botulism is a toxin. It occurs most commonly in food that's not been canned properly. However, there can be minute forms of botulism in honey and unpasteurized corn syrup. It doesn't affect adults, but it can be deadly in babies. So anyone under the age of 1 should not have honey or unpasteurized corn syrup. Pinworms. Typically with pinworms, children will have this insane itching at the rectal area that occurs at night. It occurs at night because that's when the female pinworms come out to lay their eggs around the rectal opening. And oral thrush or candidiasis, this is these white plaques in the mouth. They are not hard to remove, so it's treated with nystatin. Know the differences between bacterial vaginosis and trichomoniasis. Know the difference between bacterial vaginosis and yeast infection. Chlamydia is the most common sexually transmitted infection that we see today. It's often asymptomatic, and partners need to be treated. Know how to perform these 2 tests, the ileopsos and obturator test. I can never say that word right, the first one. Gastric reflux in the infant is not uncommon. It usually disappears between the ages of 9 to 12. There's all months. There's all kinds of gadgets out there on the market today that can help with that. But often it is keeping them erect for a certain period of time following the feeding, making sure that you're burping good or that the baby's burping good. Intussusception is actually a telescoping of the large intestine into the small intestine into the large intestine. These children will typically have colicky crying and current jelly stools. This is a medical emergency. It's never normal for them to have current jelly stool. Sports physicals and epilepsy. If you have a child come in with a diagnosis of epilepsy, they have to have clearance from neurology. They have to have good control, and there are certain sports that they cannot participate in. Scoliosis, you can see the varying degrees of scoliosis on both of these slides. Typically, there won't be any treatment intervention unless the curvature exceeds 20 to 30 degrees. Gross motor skills. This is a good thing to know. There's always going to be this question on your certification exam. I want you to focus on gross motor skills related to the cerebellum. Meningitis, these kids typically have fever, vomiting, headache, they're sleepy. These kids come in, they're very toxic. Nuchal rigidity, so they have difficulty. It's very painful to put their chin on their chest. So know how to diagnose meningitis. Microcephaly, smaller than normal head. We've been seeing a lot of this in relation to the Zika virus. Precocious puberty is any time a child begins to develop secondary sexual characteristics prior to the age of 8. Have a general understanding of the Tanner stages in female. This is something that you're going to need to know anyway. Testicular cancer and how to instruct patients to check for it. Cluster tension and migraine headaches. We spoke a little bit about headaches before. Secondary amenorrhea is any time the period stops after it's been established. Babies in the sun. We want to keep babies out of the sun because until they are 6 months of age, they have very little melanin. So, and you can't use sunscreen on kids before the age of 6 months of age. So you want to keep them out of the sun. Vesicoretral reflex. This happens in children where urine actually shoots back up, and it's because the um, development of the ureters are not complete. So the urine is much more likely to shoot back up into the kidney, and that can cause scarring. You don't see this typically in adults because with a mature urinary tract system, it doesn't occur. Down syndrome. Some children with Down syndrome have this atlantoaxial instability, which is an instability of vertebrae in the neck. And if they want to participate in sports like Special Olympics, they need to have clearance that that's not an issue. RSV. Um, RSV season is in the fall and the spring. These kids typically present with cough, runny discharge from their nose that's clear. It's incredibly contagious, especially in premature infants. If it gets to the point where these kids cannot eat, they need to be hospitalized, and the treatment, it's a virus, there's no medicine you can use, but 100% humidified oxygen. Croup is caused by a narrowing of the airway. This is croup season as well. It's viral. It causes that characteristic seal bark. Hot, steamy showers, humidified air, all of those things can help with croup. Group B strep in the newborn. Now, luckily, nowadays, all pregnant women are tested for Group B strep at about 36 weeks gestation, because a Group B strep in a child can cause sepsis and death. One of the first typical signs of early onset GBS is apnea in the infant. You can also have a low temperature. Strep pneumo, I want you to start thinking about bacteria and what it causes. Strep pneumo is the most prevalent bacteria to cause otitis media. It can also cause meningitis as well, but it's not a common cause of meningitis. It is the most common cause of otitis media. H. flu, another type of bacteria. This one you're going to see in pneumonia and acute bacterial meningitis. It also can cause cellulitis. So I want you to start thinking, if you're going to prescribe an antibiotic, you need to prescribe something that's going to cover H. flu. H. flu is an atypical bacteria, and it's one of those bacteria that amoxicillin is not going to cover.